Good morning, Namaskar. Good morning, everybody, and again, Happy New Year 2021 to all. This is Engineer Suraj Singh speaking from Bharat, India, and today's talk is regarding COVID 19 as usual, COVID 19 variant and strain, or you can say COVID 19 plus, whatever you can say, that's up to you. Title of this talk is Bharat, India, an analytical informative talk on COVID 19 plus variant strain status for January 1, 2021, reported on January 2, 2021. Government officer provided data based worked out spreadsheet file screen share for national awareness. Today it was delayed upload by ministry around 1:30 p.m. It was uploaded. I don't know reason behind that, maybe some error or some technical problem or failure on regular submission, which was around 10 to 11, usually 10:30 to 11. I view and I find change on last days posting. Well, could be some problem, I don't know. I already informed by posting that there is delay on that. If you go now, we have to talk about this. Again, I say you can see this file. We cannot say let us first go to yesterday's status, that is statewide status, which is very important for everybody to know, and that is about these columns here. We can say status, that is first one. Status means name. State means name of state or union territory. Then total cases update, and then after that active cases and discharged cases and deaths. These are three information we get from them, percentage wise reporting of that, and then our own controls discussion which we want to conduct on this, and then it is graphical submission here and projection of that, projections of this for purpose of analysis. And here's the graphics which I just amended today for purpose of information, more information, means death as well as you can say population hazard, that percentage, whatever you can call it, it's that one. So let's first move on to what happened yesterday. Let's record Maharashtra 19.356363 lakhs, Karnataka 9.20373 lakhs, Andhra Pradesh 8.82612 lakhs, Tamil Nadu 8.18935 lakhs, Kerala 7.65092 lakhs, Delhi 6.25954 lakhs, and then Uttar Pradesh 5.86751 lakhs, West Bengal 5.53216 lakhs, Odisha 3.29866 lakhs, Rajasthan 3.08852 lakhs, Telangana 2.87108 lakhs, then Chhattisgarh 2.80507 lakhs, Haryana 2.62611 lakhs, Bihar 2.52219 lakhs, and Gujarat 2.45772 lakhs, and Madhya Pradesh 2.42571 lakhs. Assam 2.162.5 lakhs, Punjab 1.66770 lakhs, Jammu and Kashmir 1.2127 lakhs, Jharkhand 1.15241 lakhs, and Uttarakhand 1.281361 lakhs, and Himachal Pradesh 55,000. Uttarakhand is also 91,281 lakhs. My mistake, I spoke lakhs, it's not lakhs. Himachal Pradesh 55,470, Goa 5,113, Pondicherry 3,816, Tripura 332, Manipur 2,820, and Chandigarh 1,979, Arunachal Pradesh 16, Meghalaya 1,344, Nagaland 119, Ladakh 952, Sikkim 590, and Andaman and Nicobar 49, Mizoram 42, Dadra and Nagar Haveli 3, and Lakshadweep 0. This is that one, you can say. This is yesterday's, and then we have to talk about these percentages of of active ratio, discharge ratio, and death ratio, just to see what happens here. This is very important one because its purpose of this analysis, what we have, this is actually our destiny that we want to find for COVID-19, how and where shall it take us. That is important point, which is most important, but unfortunately, as an engineer, as a professional, I'm unable to find some answer on this. Due to various reasons, you know those reasons. Control schedule is required, which cannot be constructed or produced without absence of additional information which is missing, which is not provided by ministry or government of this country. And there is no demand on that also. I don't know the reason, because without that schedule or without that process of controls or how to get rid of COVID-19, how to protect people in this country is not given. And how to handle whole population as far as COVID is concerned. And it is fact that we do not expect government to do it. They are not doing it all. They have not been doing it. If they have been doing it, we are not worried. But there's nothing as such they have been doing. They have been not doing anything, you can say, except publishing data and just collecting information from various states. That's the only ministry is doing, and the states are also not giving any other information. I don't know what reason behind that. We can't fix milestones, and we can't fix this final schedule, and various stages we cannot even go through. And we don't know what shall happen in coming years, or in 2020 to 2024, and 2005 to 2005 to 2025. Sorry, by mistake, it is 2025. 2025 to 2020, what shall happen? We cannot say. Well, we'll come back onto this. First, let's see. Let us see first of all this average. Average says that here 2.35 active cases percentage and 93.67 discharge patients percentage, and this 1.2%, which is deaths so far, and total of this death and active cases is 3.55%. And leave behind this because these people have gone, so they left their isolation room. They come out to the isolation room, so they left their treatment centers, hospitals, or wherever they were admitted for purpose of COVID treatment or COVID isolation, you should say, rather than treatment, because there is no treatment at all. Till now, there is no treatment of COVID-19 in the whole world, so it's just, you can say, just isolation. They have come out of isolation just after availing certain isolation period, or you can say a period which allows you to erase your immunity. Only for that purpose they were admitted. It may be in isolation, or you might be admitted from a hospital somewhere, only for that purpose. So treatment, you cannot say, and you cannot say relieved as well. Just means they have come out of there without any final recovery. So we have to take case of 1.2%. As usual, for many days I have seen that 1.2% is constant, no problem at all. 1.2% is also very, very large percentage. If you consider our population is 130 crores, and if 130 crores 1.2, you know what is 1.56 crores it is. So we will go further and say month projection is this, and month-wise it is here, which is starting first month and going to 25th month, 2 years approximately. And we have to consider population hazard. There's of course hazard means we can't. Already has started the spread to 13% people already have been detected. They have been tested, and we have seen how many people have detected. We'll go through that list. You can say 87 or 86% people are still not tested, so that's a hazard here. We can say that is population hazard because we don't know what's happening to 87% people, and we have to conduct more tests. That's essential. We have to professionally, we should do medically, we should do for purpose hazardous protection. We have to do, but we're not doing this, unfortunately, again. And then conduct rapid testing. This is not possible because we are not at all testing. It means it's people only if they feel the symptoms do exist and they go to treatment centers for testing, or laboratory, they call laboratory for this purpose. They have to pay money for that. So we can say that testing is actually a failure. Is a failure. We'll say what failure is there, because in 307 something days you say here in this file there are, you can say, you may say here what number of days it was. It was 308 days over, and we have just tested only for 13.38 people, which is negligible. You can say it's not even 35% or 50%, just 13.38%, and 86.26% population is they don't know about testing. So that is only a problem. So why say, so if you consider that way, technically and statistically and analytically, we can say that 1.2%, according to report, it is a very sheer strength of percentage. If you keep in mind 130 crore people with 1.56%, if you think, if you consider whole population, 1.56 crore percentage public has gone. You can say that. I'm not saying they have gone, there's no record, but analytically you can say 1.56% people have gone, and that is about 1.56 crore. 1.56 crore, I'm sorry, it's not 1.56%, it's 1.2%. Sometimes speaking, the tongue slip is there, and slip of tongue, and you can say 1.56 crores. Now, I according to frequently, according to changing constant value of 1.2%, because say there's a gap of 3 months, which is a quarter period. So in 3 months you must increase certain value of that. So I increased, just because it's 0.25 of any year, I apply 0.25 value to this 1.2%, so that becomes 1.5%, and then persons who left is 1.9 crore, 1.95 crores. And if you take another value, it is another 25.25, it's 1.87. So we can say there's another value of 2.44, rather than 1.56 crore, 1.95 crore, it becomes 2.44. So each value here gives something. 2.34% gives 3.05 crores, 2.93% gives 3.81 crore people left, 3.66% gives 4.76 crores people have left, for 4.58% gives 5.95 crores people have left, 5.72% gives 7.44 crore people left, and 7.15% gives 9.29 crore. This is technically, and you can say imaginary, you can say, in fact, because I don't have any evidence. So I should say statistically, or by calculation, or by interpretation, or by extrapolation, or interpolation, whatever you can say. You can apply any term on that. Whatever you apply, it doesn't matter. You keep in mind 130 crore population here, because I use this population for and use these two cells, because this is 1.2%. I calculate 1.2% out of this one is 1.5. Like that, both these values are multiplied, and we get this answer here. This and this are multiplied with this and this and this, so we get like that. It is, and you can see this graph here. You can see here, this is time period, and this is actually, this is that line. You can say it's color wise. You see this is that line, other color here, you can see other one. So that is what it is. Up to 30, it is saying up to here, up to this month, months here, it's like. So now what we say, point is this is a score of people losing their life if it goes into 2 years, according to what is current rate of death. And in 1 year period, it shall be 3.18 crore here, which is very critical value, super critical, you can say. And if it continues like that, and end of 2 years, it will be 9.29 crores, according to 3.55. But if according to 1.2, and if I just merge these two, because we don't know how many patients shall be saved here. If we merge just for understanding, just for observing results, we can say here, this is, this is score here, which varies from 4.61 crores to 27.5 crores. That's at end of 2 years. And you can see that, how it moves in this graph. It's very, very and super critical, you can say. We have to be very, very serious about this issue, as we say every day, but I come back to 1.2 just to make it easy to understand. So what we say now we say we have to talk about this. We can talk about this here or somewhere else, so I'll come back here. It's very, very important, so I have to be serious about this. And we go back to file sheet number 1. Sheet number 1 says something different, and that's here, what it says. It says, before I'll just introduce it, because it's a new year time, we have to just introduce again for maybe the person who could join first time. So it is serial number here, serial number of day, and this is report day here. Report day, I mean to say date of report, and the remarks can be something Population is 130 crore. We use actual figure in all these rows. Actual figure used in all these rows. And here are coefficients, that is percentage wise total test and percentage wise to population, whole population, which is very, very gruesome here, you can say. It's very, very negligible figure, and yesterday was 0.064 percentage, before that was 0.082 percentage, before that 0.08, like that. So means it's ignorable, you can say, negligible. And then total tests done, update, that's actual number of tests conducted till now, update of test, and that is here 1,739,4165, because 17 crores 39 lakhs 41,658. After that, you can say percentage total test done over population. What population is 1% test, that's test done over population, you can say. Test done over population percentages 13.38, that I was talking of. 13.38% people have been tested so far, which is very, very small. And if you just deduct that from 100, you find 86.62% people have not been tested. That's about 112.6 crores. So you can say out of 130 crore people, 112.6 crores have not been admitted to test so far, you can say. Or you can say they are ignored, whatever you can say. You can apply any term, whatever term, is up to you. I'm not going to debate on that, because it's not my control, it's beyond my control. Government has to decide policy, and there is no policy at all. I observe there is no publication of any policy regarding this regards. Now go back and we'll see then. The daily test conducted, how many daily tests conducted? That was, means this is individual test per day, means individual day test. And yesterday's record is 82,9964, that's 8.29964 lakhs, 8 lakhs 29,964. Where is a drop here, you can say. Again, if you compare last day, and that is last day to this date, I'm talking of yesterday's score and before yesterday, means that was end of year, which was 10.6242 lakhs, or you can say 10,62,420. So there is a drop here. Let us consider this drop, how much it is here. 108, let's keep here 108. We can just see how it works. And this is 109. We deduct from this 109, and we divide by 108 again. So we can see there's a drop of 22%. It's a very big drop. It's a drop of 22% here. You can see that one, It's really very, very worrisome. This drop is worrisome because we don't accept. This is a fall and drop. And you can say 22% drop is there, which cannot be accepted professionally. Nobody can accept this professionally. Means you did not test. Next day, yesterday, you failed to test all. Even you could not maintain this level. And if you go further back in 4 days' time, I say, or 3 days' time, you can consider this 107 rather than that one. And you can see what is dropped there, and you will find that it is, this value minus 109 and divided by 109. Wait a minute, let me check it again. Maybe I made some mistake. Let us see. For this, let us say this one drop first, and this one here 108 minus 109 and divided by 108. It should be actually 9 divided by 109. I made a mistake. So 109. So it is 28%. So I'm sorry. I projected lesser percentage. Though it's more drop. It's 28% drop in these 2 days. Very, very, really uncomfortable it is. And if we take this case of 103, so this should be 103 actually. Let us say 103, and here also I take 109. That's okay. So it's hold on. 28% drop is here. If we take this difference here, is 103 minus 105, 103 minus 109. If you take that one divided by 109, so it is some error, I think, in the calculation. 103 1 oh, it's not 3107. I'm sorry, 107. That's my mistake. 107 minus 109 or 109, that's okay now. So it's 36% drop. There are two drops. In 3 days, there's 36% drop, and in 2 days, there's 28% drop. It's really miraculous. So in 3 days, you can say, I should 3 days. In 3 days, there's a drop of 36%, which cannot be accepted by anybody. Any sensible person cannot accept that. We have to understand this point. So this is that one. This is questionable here, and we then can say after this we have to move to percentage test. Okay, percentage test. Daily test over test, total test. So how many tests you conduct in a day, and if you divide by total tests, what percentage it comes, is that one. So this is just a statistical purpose. For a statistical purpose, infection update is very important for you people. Infection update, how many infections have been updated so far, how many persons have been detected positive till now in our country, and that is, you can say that is out of this population, that is test of 17.39 crores we have tested, and out of this, how many people have been infected by COVID-19 discovered or unfolded, and that is 1 crore 3 lakh 5,788. 1 crore 3 lakhs 5,788. So many people have been observed till now according to official status. This is what it says. So let's go to next one, and that's about death. I think that's about death. Daily positive. Daily positive. Daily positive. Sorry, this is daily positive. How many people in one day? How many people in one day have been there? So they are showing last day, means yesterday, only 19,079. This is game of government. Before that it was 20,000 something, and before that, so they are just trying to bring it down to down, further down and further down. I don't know for what. That I don't know what is reason behind this. They want to show something. It's like that. They want to tell this story to whole world. Tell this story whole world. But if you take a whole story together, question is this 19,079 they are showing just out of a test of this one. Out of only this, you tested so many people and you got this much. If you take percentage of this, where should I keep something? I think there's no cell here, but let me keep somewhere here. Or I should better keep this side. So let me keep something here. Which cell be better for this? I think let me take here. It's below this only. So I take somewhere here. Let us say how many percent it is that were positive, and how many tested together, and it's like this, and they multiply by that. We got that. This is 2.29%. 2.29%. They say because 19,079 are tested positive, and this is a total number of tests in one day. So it is a 2.298%. And if you just see this one, and if you I say, okay, I want to take this one, next one here. So this is G108. And if you consider 108 here, which other one is there? So how many are there? Well, see, 108. So it is 1.8. So it's increased actually. It is 1.88 here last day. And if you take before also, if you take another one, you can say, let me put here better, I think. Hold on, please. Let me put here, this is today. You can say this is last day here. If I say other day is here, divided by this one here, multiplied by 100, I get percentage here. 8 one. If you take previous day, you say, okay, we take this one, divided by this one, and multiply by 100. We get, so it is a 3 days range, 2.29, okay, so 3% yesterday, 1.89% before yesterday, and 1.93 is that before that. So this is percentage wise. How many people were declared positive and how many tests were conducted? This is that percentages. I think it's important one to understand this. It's very important to understand this, and if we just see how it works, percentage is here, I'll find that percent directly, and that's what I say. So this percentage actually is not coming in that, no problem. So you know what I mean is, this is for yesterday percentages, this is percentage before yesterday, and this is 2 days before. This means we are not able to see 2.29 and 1.8. There's a big difference. This point we have to understand very well. Means purpose of this is that we have to understand where do we stand. So this is another addition here in this, and means this is what it says, 26% and 28%. That's 28%. There's other question here. So if I say 26 here, if I say 26 here, and anyway, we have to be very, very worried about this. And if you go further, you will find that in this column, that is here, you can say, so daily percentage, now it is death update. So death updates is that's 100 something. It is 149 to 118 till yesterday, 1,49,218, and yesterday 224. So they are showing less. That's well, it's on record. You cannot say something who dies or doesn't die. The question here is, what does this say? That this is very important point. And we have here 1106 again. This is, I stress on this always. I stress always on this, and because they stress on this, the only difference is they stress on this value. On this value, there's a conflicting consideration. They always stress this. See, we have only so many positive detected today, and they don't worry about this. They don't worry about this. That's the only difference. As a citizen, as in concerned, because a nationalist, I consider this, I consider this, I consider both, as well as this. Means this is very important, because this is only solution here. If you don't manage or organize this, we cannot solve this problem. So this is the number of patients, how many that we, it depends on this. If we cannot test people here, you see, there's no homogeneity in this, there's no uniformity in this data, not at all. So this is very important. If we have to increase this, that's important, Only important if we have to increase this, which we are not able to do it. That's what I say. With this, what we are doing is, we are only moving in a direction. I should say 9 it is now, because it's 9. So it's 9 now. So it's 1105. So according to new data, we have to be very careful about this. 1105 days for remaining untested population required for testing, which is 3 years. 3.03 years. So worrisome, really very, very worrisome. Again, every day I say it's worrisome, because 112.6 people, 112.6 crore people still required to be tested. If so, if I say if, remember, I'm not saying they are going to be tested. If, consideration is if. In that case, we have to test, if you want to finish this, not in 1105, but in 91 days or 3 months, you need someone to test 1.23 crores per day. I think that is not going to happen at all. But being an analyst, it's my duty to consider that point. It's a very important point, because this point gives direction to something. It says either we have to stand on this, that's 1105 days, which is not going to happen, because it's question of 3 years, 3.03 years, and nobody can wait for 3.03 years in this situation, in this scenario. We may say, okay, we wait for 1100 days, but you think is it possible? How many more people you lose? The question is how to save public from death or from COVID impact. That's required here. But if you say no, we can wait 1100 days, then I think that consideration will be called foolishness, it's stupidity. So nobody likes to be stupid, or nobody likes to be considered stupid or idiot. So I say 1105 is only for purpose of exhibition here. I'm doing this data to you, but we have to find alternative, and that alternative is we have to strengthen our testing system, we have to upgrade it, we have to enlarge testing scope to show a value that can test everyone in 3 months. Let us consider this way. First priority should be in 3 months. And if you say, no, 3 months is too high, too big, we can't do that, then you can say, okay, we can take a variance of 3 to 6 months. Let us consider 3 months is here, which require you to uphold your or increase or augment or multiply your current resources to 12 times what it is now. If it is 1, it should be 12. That's required here. And in that case, 1.25 crores or 1.23 crore people can be tested a day. Or you can say, look, we fix it 6. So we have to increase 6 times. This is more comfortable that you need 6 times, but it will take 3 months more. In that case, 183 days, and you have to test 61.7 lakhs people per day. That is what only I can say a comfortable situation is, and you can see this graph will comfortably change to different value. It will not be like this it is today. There's no profile of this, there's nothing, just uneven, completely uneven, down, rise, fall, rise, fall, rise, fall, rise, fall, hills, hill, valley, hill, valley, valley. It's completely childish, There's no monitoring on this, nothing is there. So the only solution is that, and what we say is then that our comments today in this case are, which is that we are sleepers, we are negligent, we are inefficient, both public and government, and government has no interest in testing all public. There's complete failure, and you can say no seriousness exists, and that's what is very important point here we have to consider. And what today's submission says something, and that is I put all this. If you see my posting, one posting was regarding there's no report till now. This is in the morning. We got 130 some upload on that site, and then I just produced that one, and I just put the note on posting note or posting that wish you best for 2020 next COVID-19 plus variant still. That's the general subject here, and Government of India uploaded on portal for 130. COVID. So what I said, an analytical informative talk on COVID-19 plus variant strain status for January 1st, 2021, reported on January 2nd, 2021, that's today. Government of India provided database worked out spreadsheet file screen share for national awareness, and there are about, you can say, 28 posting URLs, and there are about 41 video URLs. These are there in this post of video. You can see on text size 9. It says COVID-19 strain variant report update on 2nd January 2021 forenoon. Bharat public must think very seriously about how to achieve risk or loss prevention by application of required pertinent measures in relation to COVID-19 plus exposure, because nothing is being seriously done by our nation. COVID-19 strain variant has already spread in many countries such as Bharat, Canada, UK, Australia, European areas, Singapore, Hong Kong, Sweden, Jordan, and many more. I can't name all here. There are so many more. Bharat, India has crossed many days back. In 2020, 1 crore COVID-19 and also many cases of variant strain have been reported from various parts in Bharat, India. Individual cases, individual out of 130 crores, only 17.394 crores, or only 13.38 percentage population tested so far, and 86.62% population certainly remaining untested. No worry for even COVID-19 is 10% government of India or on people of Bharat. India is mostly people of ours have become sheer, careless and ignorant. No plan is available for remaining 86.62% population who have been remaining untested, which has made it impossible to fix the required milestones and schedule out prospective time scale-based plan to combat COVID-19 plus impacts. Testing has been non-conducive, extremely unsatisfactory. Real state of future of COVID-19 Bharat cannot be correctly either forecast or predicted analytically. In this connection, I had sent mails to the government in 2020, many of these URLs as included in this one, to government which email acknowledgement had been received, but no further response from Government of India, and no other plan is came informed by Government of India, and it is not expected anymore either that I will get something or they will announce. No change or accelerating program is visible, no projection of any program is available. In fact, testing speed has been still really outstandingly unsatisfactory. No reported indications seem to be on part of government to an extent testing a whole population is concerned. Government of India doesn't take any responsibility for testing of common citizen. It is assumed to be responsibility of citizen to have a test if one feels there is affected symptomized by COVID-19 plus. Government of India has this self-removing public health responsibility. Total tests conducted up to January 1, 2021, 17 crore 39 lakhs 41,658 tests conducted on January 1, 2021, 8 lakh 29,964. So downfall in testing, considerable downfall, say up to 28 to 32%. Total corona infections till January 1, 2000 is 10, 1 crore 30 lakh, 1 crore 3 lakhs 5,788. Again I say 1 crore 3 lakhs 5,788, 788. Positive cases declared on January 1st, 19,079 only. Manipulated data, that's just the intention. They want to drop it. They want to hide reality. That's update till January 1, 2021, 1 lakh 49,218. Population tested 30.38% only since March 2020. Remaining population remaining without test 86.62%. Time required for whole population testing is 1275 days, while time required for remaining population testing, according to this calculation, 1105 or whatever it is. I think it's 1105 days. So I corrected 1105 days. Well, no problem. Is 2000 is 1275 or 1105 required days admissible. Whether public has to accept it or public has to reject it, public has to consider this point very seriously in national interest. Why is government not improving its bad performance? Not clear. Government doesn't respond and shall not respond at all, just to protect its own thick skin. Government has actually ignored poor and lower class society members from testing. Why is government sleeping? No answer. And public too sleeping. Unknown worry, less state of public. Government doesn't look anxious to test all citizens. Testing speed is too slow. Why should people of Bharat, India suffer for none of their faults? Only sufferers are poor sections of society who cannot afford treatment and testing fee. Why are suffering people not raising their voices? Have people become voiceless? People of Bharat, India are not living as slaves but have become virtual slaves of current Modi's design. Why has government left this responsibility on the people onto their own? It seems that all people shall not be tested because till now no such policy seems to exist and no addition as such in non-existing policy of government has been observed. Really speaking, there exists no government policy towards public handling of COVID-19 is trained plus have tested yourself, therefore members of society, poor people, if you intend to be COVID-19 tested, do it by your own expense because the government, no government exists for you. You spend 1,200 to 2,400 rupees for testing one time. After testing is over and having detected positive, pay for your treatment as well, along with medical assistance costs. Remember that medical attendance charge is 1,500 to 3,000 rupees per day if you isolate in your own room. Also, all expenses of attendance, food, boarding, and lodging you have to afford. You have to buy protocol-related medicines, injections, oxygen if required, pay for ventilator as well, and all PPE is necessary for attendant. If you stay in hospital, room rent should be, if you stay in hospital, room rent itself costs you around 10,000 to 20,000 per day, a minimum, in a good hospital. Therefore, be ready with many lakhs rupees. People shall have to decide for themselves, for there is just no one responsible for you from government. COVID-19 virus explosion has to happen, come what may due to inefficiency and sleeping attitude of government. And lethargic public COVID-19 shall certainly explode in Bharat, India in form of COVID-19 plus variant, the strain nuclear fission, a nation where neither public is serious nor government is serious, nothing other than anticipated explosion would happen. A society that remains non-serious and on top of that sleeping shall have to face those offending adverse results for sure, for certain. A nation that cannot think to resolve problems seriously, such results are imminent thereat. Nation cannot wait for years to have prevention and implementation from the impact of COVID-19. Out of my understanding, the 1.3 billion people, including many crores intellectuals, but lives are still completely, it is perfectly speak of all to take necessary action because government is in totally lethargic. People must think for nations and not government. Government is trying to ignore COVID-19 by diverting issues. Think to get a working government, not current sleeping one. Political guard can also sleep and often sleeps. It's true. This is what I say about today's report, and it's very well. Whatever it is, I was able to do my job today itself, though it was delayed, completely delayed. Now we have to see what I was talking about that here. This is a very important point here, and this 35 crores are still on way to COVID effect. I can predict that rather than 9 crores, which this official website record predicts 9 crore infection of expected. You can say infection data assessed in crores. It is that infection data assessed. But why say this is what I can just highlight this and say this, this is what I expect. This is what I expect in this data. These are here. This 9 according to this 35 according to our our own projection. So this is very serious here. We have to see how to do it, how to protect it, and how to maintain this. That's important. And this how to use this data. This is very uncomfortable data. You can say if you just put in small values, we can say it's okay, fine now. So this percentage here of this test, so this is our percentage. If you take three average of these three, we can say average of these data. If you take these three data as average, I think this is 2.04 average. Average in these 3 days. In these 3 days, number of tests conducted and how many people contracted COVID, and that is 2.04%. This means on testing day this is like this. So 2.3% every day we are getting. This means if you say 130 crore people are tested immediately today, so what shall happen? 2%. It's not small. It's 2.6 crore people a day. Do you understand that? Just imagine that 2.6 you get today, 2.6 crore, and put on 1.25 factor further and further. What shall happen? It's not imagination. It's a fact. It's a real fact. So what I say, we have to be very logistic, means logical people we should be, and we have to come on to this means how you want to solve this. Prediction is that this COVID is going to work up to 2029, it started in 2020, actually it started in 2019 and is intensified in 2020, and it shall continue up to 2024 on rising curve, and then it will start dropping and will reach 2019 to get the exit from world. This is a prediction, not my prediction. Scientists say like this, and I just used my numbering status and got it. So we have to be very, this is required. Control is scheduled and cannot be charted out. This is my problem. This is my big problem. This is the required. We don't have this answer. So we have to fix this as well. We don't have this answer, and we have to understand this testing. We don't have this answer. These are very important points that we have to understand from professional viewpoint, not from just viewpoint, and that point is very important for everyone. If you want to help nation, if you want to help yourself, you understand this theory and this practical approach, I think that should be fine answer. Just cannot wait only. Waiting is no solution. 1100 something is no solution. Solution is immediate. The 3 months period is quite logical of such a population. Or you can say 6 month we can give relaxation for 6 months, keeping flexibility in view. But resources must be intensified, must be upgraded, must be multiplied. You can say augmented to a level, say 6 to 12 times. Otherwise, we have to face hell of situation. We have to face, you can say something which even atom bomb cannot result. This would result in. Even your nuclear fission cannot damage something that this is going to damage, and that's the only reason I'm calling this that this is COVID-19 plus nuclear fission. So there's nothing else, because after all everything has an atomic structure, and COVID-19 itself is an atomic structure, so you can say that it's going to harm everybody. We have to be very fair, and we have to decide what to do. Safety is very important, health is very important, environment is very important. So this is a question of public health of 130 crore people. So we have to be very serious in this case. We have to consider this very seriously, not amusingly, not, you can say, laughingly. As usually, every day I every day try to say that We have to consider risk prevention method and not loss prevention method. I mean, say, not suppression method. Where suppression and prevention are different. When there's fire on a house, you want to extinguish fire, and that's called suppression. And you know fire is going to happen this way or that way. There's some chances of fire. So in that case, you take protection your way, and that protection I'm talking of, so that you avoid fire by your own intellectualism, by your own thoughts, by your own methods, and that's what I'm talking of. That fire must be prevented, just like we do in buildings. We have to take certain design issues we consider, and we design members of building like columns and beams and slabs accordingly, so that 1 hour or 2 hour fire prevention is, because you can't stop fire, but we can take preventive measures just to prevent or reduce loss of life and loss of materials, and that's a very important one. And it applies not only in buildings, it applies everywhere, and same thing applies here in COVID-19 also. If you want to know today what could happen, you can resort to certain solutions, and that's what this talk is meant for. If you know today how many people are going to be affected by COVID according to these statistics or reports, then we can take, just the example solution is augment your resources, test as many people as you can, because there's there's no system, there's no organization. It seems our nation does not have any sound organization or efficient organization, or you can say educated or professionally qualified organization to handle COVID issue. Currently, I don't know what shall happen in future. Government is not giving an indication that it's going to augment resources or it's going to do something. There's no indication on this report. And it's nothing, not against government, someone, but question is, public interest is first, not government interest. That's my consideration. We have to think for people's safety, we have to think for people's health, and we have to think for people's benefit, come what may. Government benefit or no benefit doesn't matter. Government is just to help people, and if government doesn't help, people have to help themselves. And that's the state today. Government is not doing any intention. There's no interest at all. No interest. If 35% fall in your, testing one day, 2-3 days, how can you say government is responsible? Government is not acting responsibly. Government is not working responsibly. Government has no intention at all to control this. I don't know reason behind that. They want to save money. Money is more important than cost of people. Money is more important, but people have to manage themselves. Don't think of government should help you. Again, I'm saying government is not going to help you at all. Government can't help you. Government hasn't helped you. Government just try to make money out of this. As I understand, they have ignored public. They have ignored public. I'm speaking with full confidence of my work that I could understand this analysis, and government has to do something, had to do something, but no, they can't even publish in time this report. So there is something wrong. I'm not attacking them. I am attacking this situation. Situation is very worrisome, extremely worrisome, and we must find outstanding solution. And for that, it should be conducted on war footings, not on ordinary footings. They are not doing anything, unfortunately. This analysis is saying that if they can't test, they reduce test every day or every 2 or 3 days, how can you expect them to think of whole population? Not possible. Therefore, I would say, better for your future, you arrange and get yourself tested, particularly those people who think maybe you are very strong, you are having immunity developed, this means you have resistance to impact of COVID, but you don't know even you are strong. COVID didn't ask anybody, it doesn't ask anybody, and it shall not ask anybody entry visa into your body. So you will get it and you don't know it. You may not know it. That is very, you can say, dreadful situation. And it's common that out of sorry, because you're now going into precautionary measures which are required. So absence of precautionary measures and absence of even consideration of maintaining good health or testing, absence of testing, all these factors accumulate to hazard. That is called hazard. That hazard that hazard is required. That hazard is required to be prevented. And that's called risk prevention. We in our work say job hazard analysis. Job hazard analysis. There is a job, you're working a job, and you have to think on how, if some accident happens, if something wrong action happens, some negligence happens, how to prevent that accident, if it can lead to accident. And that's called pre-study. Before doing a job, we are going to do this work. This can be risk there, or this can be another risk there. We take into consideration all those risks and then how to prevent this risk, and that's called risk prevention. If you don't take that and just do his job, and somebody falls or something happens, means you have to spend money on life, you have to spend money on treatment, you have to spend everybody or person. If suppose person is a tall, means a tall person is a person loses life, that's costly. That's the cost. Even if you have insurance, somebody will pay for this. My question is, my consideration is, my submission to you is, I'm saying submission means acceptance or rejection lies in your hand, not in my hand, because risk prevention is very important in all affairs of life. You must know what risk is there, and this is what I'm talking of. This risk is there, and government is not doing anything to prevent that risk. So when government is not doing, then we know risk is there, and government also knows risk is there. But government has given you self-reliance mode that you do it yourself. That is a message from government. Otherwise, they would have done something. They are not doing anything. There's I'm not finding any specific preventive measures the government is doing, except this that okay, don't come out, we wear mask. It's very common. Government need not say wear mask. This is not job of government, but people have to do it themselves. People have to conduct tests themselves. Even if you don't have money, you should go to government hospital and ask them, I want test. That's the only way. Go to government hospital, conduct tests. What's wrong with that? It's your hospital, you're paying taxes. You overload them. That's the only way. Maybe they are sitting without any patient. Go and do it. Let government take care of that. At least you shall know that you are infected or not infected. That's an important point. If you are not infected, fine, you will be lucky, and you take precautionary measures, resort to precautionary measures, in future you are safe. And no, if you say, no, I'm infected, then you are lucky that you have been discovered, you have been detected, you have been declared positive, so that it's early stage, and you can have isolation treatment, isolation procedure, and possibly you will take medicines according to protocol, and whatever it is. And if you are in your own home, fine, or if you are in government center, that's also fine. So your initiative is required. If government is not doing anything, go to government centers and government hospitals and avail facility. It's a question of one day, I think, maximum, that they would test you. If positive, ask for treatment, and if not positive, then fine, you are free, you are happy. Just resort to methods, preventive measures, so that you do not have invitation to come to your guest, to spoil your body. This is what I say. I think I submitted my today's point of view and continue every day. I could not speak in Hindi today, थोड़ा सा बता देता हूँ हिंदी में भी. कुछ लोग कहेंगे आज अंग्रेजी बोले जा रहा है, हिंदी में नहीं बोल रहा. क्या करूँ, कभी कभी होता है. मैं नहीं चाहता वीडियो बहुत लंबा बन जाए. मैं ये कह रहा हूँ आपसे कि कल जो भी टेस्ट हुए हैं बहुत कम हुए, और अब मुझे लगता नहीं है कि सरकार कोई इनिशिएटिव ले रही है इस मामले में. मैं बुरा नहीं कह रहा कि सरकार गलत है या सही है, मैं कुछ नहीं कह रहा, लेकिन मैं ये कह रहा हूँ कि जो होने जा रहा है, जो दिख रहा है इस डाटा से, वो एक अजीब सी सिचुएशन बनती जा रही है हर रोज़. जो मैं नहीं बता रहा, डाटा बता रहा है. डाटा एक हॉरिफाइंग मैसेज दे रहा है, क्योंकि टेस्टिंग स्पीड बहुत कम है. अगर टेस्टिंग स्पीड ज़्यादा होती, इनका कहते हैं हमने आज 20 लाख आदमी हो, अब 25 लाख आदमी, 30 लाख है, 40 लाख आदमी टेस्ट किए हैं, 50 लाख आदमी टेस्ट किए होने चाहिए. अभी तो ये 8 लाख कह रहे हैं, कभी 10 लाख कह रहे हैं, कभी 11 से तो आगे बढ़े नहीं हैं ये. 8 लाख देखो, मैं पिछला अगर आप देखेंगे तो ये है किधर है टेस्टिंग, यस इधर 19,000 अब बता रहे हैं ये। उससे पहले 20-25 की रेंज में आए, थोड़े दिन पहले 30-35 की रेंज में थे, फिर 40 की में थे, कभी 50 की में थे, कभी 60-70 की 1000 की रेंज में थे, 90 की, 79 तक गए। लेकिन अब ये शान दिखा रहे हैं कि हम जो है ना, देखिए 19,079 पे आ गए, हम 20,035 पे आ गए। ये सब ड्रामा है। ये वो चीज़ दिखा रहे हैं जो आपको अच्छा लगे। ये नहीं बता रहे कि हम टेस्ट कितने कर रहे हैं। डाटा बता रहा है, लेकिन डाटा पकड़ना भी जरूरी है ना। वो तो डाटा दे रहे हैं, आप समझ नहीं आएगा। आप जब तक उसमें आप बारीकी से उसकी स्टडी नहीं करेंगे, आपको समझ नहीं आएगा। डाटा तो ये कह रहा है कि अभी तक 17 करोड़ 39 लाख लोगों का टेस्ट हुआ है। 17 करोड़ 39 लाख लोगों का टेस्ट हुआ है, इसका मतलब 130 करोड़ में से तो कुछ भी नहीं हुआ है। 13.38%, तो आप 14 मान लीजिए, आप 13 मान लीजिए, कुछ भी मान लीजिए, इतने % लोगों का टेस्ट हुआ है, तो इसका मतलब काम नहीं चल रहा है। और ये टेस्ट एक दिन का नहीं है, ये टेस्ट है 308 दिनों का। 308 दिनों का टेस्ट है। इसका मतलब एक दिन में इन्होंने 5,64,746 व्यक्तियों का टेस्ट किया। अब आप बताइए, 5,46,000 एवरेज का टेस्ट एक दिन में हो रहा है, और कल जो किया 8,29,000 का किया। इसका मतलब है ये नहीं काम कर रहे हैं भाई। अगर इतने दिन लगते हैं, 308 दिन में इन्होंने नहीं टेस्ट किया, सिर्फ 17 करोड़ लोगों का टेस्ट किया, तो इसका मतलब वो देश के लिए काम नहीं कर रहे। वो एक फॉर्मेलिटी के लिए डिपार्टमेंट खोल दिया होगा, और जाओ अभी टेस्ट कर लो बस। अरे 1100 दिन कौन वेट करेगा, वो भी जानते नहीं हो पाएगा, इसलिए शायद चुप हैं, वो बोलते नहीं हैं। बस हमने डाटा दे दिया, हमारी बात खत्म हो गई, हमारा काम हो गया, अब आप संभालिए, आप काम संभालिए। तो भैया देश ऐसे तो नहीं चलता ना। अगर लोग मर गए, करोड़ों लोग मर गए, तो कौन जिम्मेदार होगा उसका। ये जिम्मेदारी भी लेने वाले नहीं है, क्योंकि ये बात ही नहीं करना चाहते। वो बात करना चाहते नहीं करते। मेरी प्रॉब्लम ये नहीं है, वो जिम्मेदारी लेते नहीं है, लेकिन पब्लिक को सोचना पड़ेगा। मरेगी तो पब्लिक, मिनिस्टर तो नहीं मरेगा ना। उनके लिए तो एम्स हैं, उनके लिए तो प्राइवेट अस्पताल भी हैं, उन्हें कोई दिक्कत नहीं है। उनका तो एक सिस्टम है, वो तो जाएंगे इलाज करा लेंगे अपना। उनके तो डॉक्टर भी सलाम मारेंगे और सब सलाम मारेंगे, आपको कोई वहाँ एंट्री भी नहीं मिलेगी। तो भाई ये है, इसलिए मेरा सिर्फ ये है कि पब्लिक की वैल्यू नहीं होती है जिस देश में, जहाँ कोई ख्याल नहीं करता है उनका, जब उनके लिए इंफ्रास्ट्रक्चर नहीं है, ज़्यादा अस्पताल नहीं है, या इतने लोग बीमार हो गए तो उतने अस्पताल नहीं है, आप कह सकते हैं उतने डॉक्टर नर्स भी नहीं होंगे। मान लीजिए एक दिन में 1 करोड़ लोग बीमार हो गए, 2 करोड़ लोग बीमार हो गए, हो सकता है, कोई बड़ी बात तो नहीं है। ये डाटा कुछ भी दे रहे हैं, वास्तविकता क्या है तो आपको पता नहीं है। उसका एक ही तरीका है, आप अपने आप टेस्ट कराइए भाई, सरकार से कराइए या प्राइवेट लेबोरेटरी से कराइए। एक बार करा लेंगे तो कम से कम मन को शांति तो रहेगी कि हाँ भी मैंने टेस्ट करा लिया, मैं बीमार नहीं हूँ। एटलीस्ट कुछ तो इनका रिकॉर्ड भी बढ़ जाएगा उसमें, कि आप जब आप खुद जा रहे हैं टेस्ट कराएं, तो ये 8 लाख जो कह रहे हैं, हो सकता है वही 25 लाख हो जाए, 30 लाख हो जाए, तो कुछ तो होगा। ये 1104 की ये बीमारी तो मिटेगी, 1105 की। मैं सिर्फ ये कहना चाहता हूँ, आप गवर्नमेंट के बारे में मत सोचिए, आप अपने बारे में सोचिए, अपने परिवार के बारे में सोचिए, अपने बच्चों के बारे में सोचिए, अपने समाज के बारे में, नेबरहुड के बारे में, जो भी आप सोच सकते सोचिए। आप दूसरों से कहिए भाई टेस्ट तो कम से कम करा लो। लोग झिझकते भी हैं, मैंने देखा है, अरे मुझे कुछ नहीं हुआ। अरे आप कैसे कह सकते हैं आपको नहीं हुआ, बताइए। मेरे घर में मेरी बड़ी बहन को, वो भी ऐसे ही कहती थी मेरे को कुछ नहीं होगा, मुझसे 2 साल बड़ी है, मुझसे कहते थे मुझे कुछ नहीं होगा। हमने टेस्ट कर, बुखार था उसको, क्या जो भी था, टेस्ट कराया तो उसको निकल आया पॉजिटिव। अब क्या करें, मेरे 2 रिश्तेदार हैं, उनको निकल आया। तो भाई ये कहना कि नहीं होता है, ये बात नहीं है, ये किसी को भी हो सकता है। तो उसका ये है कि आप अगर करा सकते हैं तो टेस्ट तो करा लो। आप नहीं जाना चाहते अस्पताल दिखाने के लिए, तो आप घर में बुला लो, पैसे दो, फिर आप भी है 1200 रुपये लगते हैं सबर्बन एरियाज़ में, 2400 रुपये लगते हैं सेंट्रल एरियाज़ में, जहाँ जो मेट्रोपॉलिटन सिटीज़ होती हैं। तो ये तो आपको फिर करना पड़ेगा, अगर आप देश का हित चाहते हैं, अपने परिवार का। और आपको लग गया बाद में तो क्या करेंगे बताइए। वही बात मैं कह रहा हूँ ना, ये बातें करने के लिए नहीं है, बातें समझने के लिए हैं। हम आँख मीच के नहीं रह सकते, और हमको अपना भी सोचना है, अपने देश का भी सोचना है, अपने परिवार का भी सोचना है। और आप उसको नहीं सोचेंगे तो भाई देखिए, ये डाटा तो रोज आएंगे, हम बातें करके चले जाएंगे। हम भी हो सकते हैं भाई, हम क्यों नहीं हो सकते। मेरी जब सिस्टर को हुआ तो मैं वहीं रहता हूँ जहाँ वो रहती है, तो मुझे भी क्वारंटाइन था, हालांकि मैं बिस्तर में ही था, मेरे को चोट लगी हुई है, फ्रैक्चर हुए हैं पैर में, मैं तो वैसे ही बिस्तर में था। उसको क्वारंटाइन में भी रहना पड़ा, मुझे दवाई भी खानी पड़ी 5 दिन की, उसका प्रोटोकॉल होता है कि जो क्वारंटाइन कर रहे हैं उसको भी कुछ मेडिसिन खानी पड़ी, तो मैंने भी खाई। आई जस्ट कंज्यूम दैट मेडिसिन, आई टुक मेडिसिन फॉर क्वारंटाइन पर्पज, दैट्स प्रोटोकॉल। तो उसमें कोई क्या करेगा? कहने का मतलब ये है, मेरी भांजी को हुआ, मेरे ब्रदर इन लॉ को हुआ, ठीक है, वो क्वारंटाइन से बाहर आ गए, उन्होंने वो पीरियड पूरा कर लिया। सवाल ये नहीं है, सवाल ये है एक्सट्रीम हो जाए तो आप क्या करेंगे? बढ़ जाए, मान लो आपने इलाज ही नहीं देखा, आपने टेस्ट ही नहीं कराया और अंदर ही अंदर पनप गया आपका, तो आप एडवांस स्टेज में चले गए, तो फिर वेंटिलेटर की जरूरत पड़ सकती है, आपको ऑक्सीजन की जरूरत पड़ सकती है। वो एक्सपेंसिव है, ऑक्सीजन का किराए पे भी लाएंगे तो महंगा पड़ता है, सस्ता तो नहीं पड़ता है। ऑक्सीजन लेनी पड़ेगी आपको, वेंटिलेटर लेना वो बहुत महंगा पड़ता है, आपको दाखिल होना पड़ेगा अस्पताल में, और सरकारी अस्पताल में आपको नहीं मिला तो प्राइवेट में जाना पड़ेगा, तो वहाँ तो पैसे लगते हैं, कई हज़ार रुपये लगते हैं एक दिन के, कमरा भी लेना पड़ेगा। ये सारी बातें हैं जो आपको शायद आज नहीं समझ आएंगी, लेकिन ऐसा हो सकता है। मेरा पर्पस उन लोगों के लिए है जो ये चीज़ें अफोर्ड नहीं कर पा रहे, जो हायर मिडिल क्लास के हैं या पैसे वाले हैं, वो जो बाकी 15% लोग हैं, मैं उनकी बात नहीं कर रहा। ये जो 87% में 86% में जो लोग आते हैं ना, मैं उनके लिए वरीसम हूँ। जो बेचारा मजदूरी कर रहा है डेली, या लेबरर है, या वो कोई ट्रेड्समैन है, या प्रोफेशनल है, या वो रेडी लगाता है, जो कि 300-400 रुपये रोज़ कमाता होगा, या नहीं भी कमाता, ज़्यादा कमाता होगा, फिर भी वो अफोर्ड तो नहीं कर पाएगा। कहाँ से अफोर्ड करेगा? अगर उसको एकदम 2400 रुपये या 1200 रुपये देने पड़े, एक तो वो झटका लगेगा। फिर मान लीजिए उसको निकल आया जी, हाँ जी आपको है माइल्ड स्टेज से ही या एडवांस स्टेज से, उसको फिर मुसीबत। हर घर में तो कमरा नहीं होता है कि मेरे पास रूम पड़ा है मैं तो उसमें रह लूँगा। जिसके पास है ठीक है, वो फॉर्चुनेट है, भगवान ने उसको दिया है, लेकिन जिसके पास नहीं है वो क्या करेगा? कहाँ क्वारंटाइन करेगा? तो उसको अस्पताल जाना पड़ेगा, अस्पताल में जगह नहीं मिलेगी। तो भाई आपकी लाइफ रिस्क पे है, किसी सरकार की लाइफ रिस्क पे नहीं है, यहाँ किसी मिनिस्टर की लाइफ रिस्क पे नहीं है, प्राइम मिनिस्टर की लाइफ रिस्क पे नहीं है। रिस्क में आपकी लाइफ होगी, आपकी वाइफ को प्रॉब्लम होगी, आपके भाई बहन को प्रॉब्लम होगी, आपके माता पिता को प्रॉब्लम होगी, जो भी होगा। ये बातें माइंड में रखनी चाहिए। सबसे बड़े तो हाफ हिट हुए, और बाई चांस आपका बिगड़ गया मान लीजिए, तो क्या करेंगे आप? इसलिए ज़्यादा ये हवाबाजी में रहना ठीक नहीं है। ये एक ऐसी बीमारी है जिसका एक तो कोई इलाज नहीं है। आप मान लो 17 दिन आइसोलेशन में रह भी गए, और जो नहीं है परिवार के मेम्बर को क्वारंटाइन करना पड़ेगा। दोनों के लिए एक ही बात है, खर्चे दोनों के लिए होंगे, आपके खर्चे तो होंगे ही होंगे, वो मुसीबत पड़ेगी आपको। आप चाहे लोन लें या कुछ भी करें, सरकार ने तो देना नहीं है आपको, फिर आप ही की प्रॉब्लम बनेगी। और आने वाले टाइम में तो ये बढ़ने वाली है, घटने वाली तो है नहीं। कोई सोचते हैं लोग अरे कुछ नहीं है, कुछ नहीं है। अरे गलत फहमी का शिकार मत रहो। ठीक है, आप नहीं इलाज कर रहे अपना, नहीं आप प्रिकॉशन ले रहे, इसका मतलब ही नहीं आप हवाबाजी कर जाओ। दुनिया फंस चुकी है, इंग्लैंड फंस चुका है, आप देखिए पूरा यूरोप फंस चुका है। 50-50 हज़ार केस हो रहे हैं फ्रांस में, इंग्लैंड में, दूसरी जगह वो सबसे ज़्यादा केस हो रहे हैं आजकल, जो पहले भी नहीं हुए। कितनी कंट्रीज़ में आ चुका है, मैंने पढ़ के तो आपको बता दिया। इसलिए भाई गलत फहमी का शिकार मत बनो। ये एक बार प्रॉब्लम आ गई तो आ गई, फिर आप इससे बच नहीं सकते, ये तो पक्की बात है। किस्मत वाले हो, अर्ली स्टेज में पकड़ लिया तो हल्का फुल्का हुआ होगा, तो आपको आपको 10-15 दिन के आइसोलेशन में, 17 दिन की आइसोलेशन के बाद जान छूट जाएगी। और आपको हो गया, आपके घर वालों को 10 दिन की क्वारंटाइन में जान छूट जाएगी। कम से कम बचे तो रहोगे। इसलिए मैं रोज़ इसीलिए बताता हूँ सबको कि भाई आप बच जाओगे तो आपके लिए भी अच्छा होगा और समाज के लिए भी अच्छा होगा। आप और स्ट्रांग हो जाओगे, लड़ने के लिए कोविड से तैयार हो जाओगे। लेकिन अगर आप नहीं करेंगे तो नुकसान मेरा नहीं है, देश का है। मेरे को भी क्वारंटाइन होना पड़ा, बताया ना आपको, तो किसी को भी प्रॉब्लम तो होगी। इसलिए जब हमारे देश की सरकार सो जाए, जो कि साफ है इस मामले में सो रही है, आप तो मत सोइए ना। मेरा कहने का मतलब है, मैं आपको जगाना चाहता हूँ, आपको उठाना चाहता हूँ सोते नींद से। और जो आपके अंदर एक बेफिक्री आ गई है, एक ऐसी स्टेज आ गई कि आपको चिंता नहीं है किसी चीज़ की इस विषय में, तो वो गलत है। ये अभी शुरू हुआ है, अभी तो ये अपना ड्रामा दिखाएगा। आप सोच रहे हैं चला गया, ऐसा नहीं है। ये एक विस्फोट की तरफ जा रहा है हमारे देश में, क्योंकि हमारे देश में पॉपुलेशन या आबादी जनसंख्या बहुत ज़्यादा है। आज की तारीख में आप चाइना को छोड़ दीजिए कि वो कंट्रोल में है, हम कंट्रोल में नहीं हैं। ये सच है। अगर हमने 10 महीने या 11 महीने में भी 13-14% लोगों का टेस्ट नहीं कर पाए तो हमारी क्या औकात है, बताइए आप। हम किस स्तर के राज्य हैं, देश हैं, जिन्हें अपने पब्लिक की चिंता नहीं है। लोगों को गुस्सा आ जाता है जब मैं कहता हूँ या लिखता हूँ, पता नहीं क्यों गुस्सा आता है, सच बोलने पे गुस्सा आता है। अरे सब सरकार कुछ नहीं कर रही, मेडिकल की बात है, हेल्थ की बात है, वरी है। सरकार थोड़ी जीने देगी हमको, सरकार थोड़ी खाना देगी हमको, सरकार थोड़ी हमें इलाज करने को दे रही है। खर्चे तो हम कर रहे हैं, सरकार क्या कर रही है? सरकार का कंट्रीब्यूशन क्या है इसमें? मेरे जो घर में खर्चा हुआ कौन देगा? मेरे रिश्तेदार का जो खर्चा हुआ कौन देगा? सरकार तो नहीं दे रही है, इंश्योरेंस भी नहीं दे रही है। तो खर्चे तो हमारे सर पे आ गए ना। गलती किसकी? हमारी गलती है क्या? ये डायबिटीज की बीमारी थी हमको, हार्ट अटैक की बीमारी थी, ये तो सीधा लग गया। तो सरकार जिम्मेदारी नहीं ले रही है, ये सच बात है। आपको भक्त को बुरा लगता है तो लगता रहे, सच बोलने में क्या बुरा है? आपको भी प्रॉब्लम है भक्तों, आपके घर में भी आएगा तो क्या करोगे? सबको है प्रॉब्लम। यहाँ पॉलिटिक्स नहीं है, यहाँ कोई बीजेपी कांग्रेस नहीं है, ये समाज की प्रॉब्लम है, हर देश की प्रॉब्लम है। इतनी सी बात हमको समझ नहीं आती, हम क्या करेंगे? विषय तो बनता है बात करने का, इसलिए मैं थोड़ा एक्सप्लेन करके आपको हिंदी में भी कि डाटा विषय का आप पूरा मत देखो, मत सुनो, लेकिन सीरियस तो रहो। 17 करोड़ का टेस्ट नहीं कर पाई सरकार अभी तक, 17-18 करोड़ का। बातें करते हैं बड़ी बड़ी, हमने बहुत अच्छा। आप इनकी वेबसाइट पे जाके देखिए ना, उसमें क्या लिखा है, बताता हूँ क्या लिखते हैं। बड़ी बदमाशी है इन लोगों में, देखिए क्या लिखते हैं। ये लिखते हैं, गवर्नमेंट ऑफ इंडिया इज टेकिंग ऑल नेसेसरी स्टेप्स टू एंश्योर दैट वी आर प्रिपेयर्ड वेल टू फेस चैलेंज एंड थ्रेट पोस्ड बाय ग्रोइंग पैंडेमिक ऑफ COVID-19 coronavirus. With active support of people of India, we have been able to contain the spread of virus in our country. Most important factor in preventing the spread of virus locally is to empower citizens with right information and taking precautions per advisories being issued by Ministry of Health and Family Welfare. ये इन्होंने लिखा है, आप सोचिए। मैं इसका हिंदी में देखता हूँ क्या लिखा है, एक मिनट। हिंदी 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 कहाँ है भाई? हिंदी में देखते अगर मिलता है मुझे तो उसका मैं पढ़ के बताता हूँ आपको, क्योंकि ट्रांसलेट तो नहीं कर पाऊंगा मैं इसको। अगर ये मिलता है मुझे, अभी देखता हूँ फाइल आती है कि नहीं आती है। अगर आती है तो मैं आपको पढ़ के बता दूँगा, उसके बाद मैं क्लोज करता हूँ इस वीडियो को। अभी तक तो फाइल आई नहीं है, अब वो इंग्लिश का पीछे गायब हो गया। कोई नहीं, देखते हैं। जस्ट पेशेंस भी रखना चाहिए, थोड़ा सा सब्र होना चाहिए। और अभी तक तो भाई आ तो रही है, देखते हैं क्या कोरोना वायरस कुछ तो आया है, थोड़ा थोड़ा, पूरा नहीं आया है। हाँ आ गया, देखिए मैं आपको पढ़ के बताता हूँ क्या कर गया। COVID-19 कोरोना वायरस की महामारी से उत्पन्न चुनौती और खतरे से निपटने के लिए भारत सरकार सभी आवश्यक कदम उठा रही है। देश की जनता के सक्रिय सहयोग से हम देश में वायरस के प्रसार का नियंत्रण करने में सक्षम हैं। स्वास्थ्य और परिवार कल्याण मंत्रालय द्वारा प्रदान की गई जानकारी और सलाह को सावधानी से सही तरीके से पालन कर वायरस के स्थानीय प्रसार को रोका जा सकता है। अब बताइए, ये कह रहे हैं हम सब कुछ कर रहे हैं, मैं दोबारा पढ़ दूं। COVID-19 कोरोना वायरस की महामारी से उत्पन्न चुनौती और खतरे से निपटने के लिए भारत सरकार सभी आवश्यक कदम उठा रही है। अब बताइए कौन सा कदम उठा रहे हैं? मेरे समझ नहीं आया कौन सा कदम इन्होंने उठाया है। बस एक पब्लिश कर देना डाटा कदम है, या पहले लॉकडाउन किया था वो कदम है? क्या हुआ उससे? कुछ नहीं हुआ उससे। देश की जनता के सक्रिय सहयोग से हम देश में वायरस के प्रसार को नियंत्रित करने में सक्षम हैं। मेरे को समझ नहीं आया क्या कहना चाहते हैं ये। आपको समझ आया तो क्या सक्षम है ये? तुम टेस्ट नहीं कर सकते यार, काहे के सक्षम हो तुम? क्या टेस्ट किया तुमने अब तक? जब तुम टेस्ट नहीं कर सकते तो पता कैसे लगेगा कितने लोग बीमार हैं? स्वास्थ्य और परिवार कल्याण मंत्रालय द्वारा प्रदान की गई जानकारी और सलाह को सावधानी व सही तरीके से पालन कर वायरस के स्थानीय प्रसार को रोका जा सकता है। बस इतना कह दिया, इनकी ड्यूटी खत्म। वाह वाह मेरे देश की सरकार और वाह देश के लोगों, आप हर बात से संतुष्ट हो जाते हैं। या कुछ नहीं किया इन्होंने और कह रहे हैं हमने सब कुछ कर दिया। खैर छोड़िए इन बातों को, अब हम चलते हैं अपने अपने बात पे। और अब ये मैं नहीं जानता और लंबा खींचूं इस वीडियो को आज को, क्यों मैं थोड़ा सा आज आपको बताना चाहता था नया वर्ष शुरू हुआ है, 2021 शुरू हुआ है और कम से कम 2021 को ही संभाल लें। 2021 में ही संभल जाए तो भी अच्छा कहलाएंगे। मैं तो 3-4 महीने की बात कर रहा हूँ, लेकिन वो तो एक ख्याली पुलाव है। 3-4 महीने में कुछ नहीं कर पाएंगे, क्योंकि बिना सरकारें बिना बिना आपकी आई मीन टू से बिना बिना टेस्ट के, बिना किसी चीज़ के हम सच तो ये कुछ भी नहीं कर सकते हैं। बातें करने का क्या है, बातें तो कोई भी करेगा, बातें करने से क्या फ़र्क पड़ता है, कोई भी बात करेगा ना आपसे। सरकार तो बोलेगी, सरकार ये तो नहीं कहेगी ना हमने गलत काम किया है। तो सरकार तो यही कहेगी भाई हमने सब कुछ ठीक किया है, हमने संभाल लिया है आपको। अब क्या संभाला ये आप खुद देखो, क्या संभाला है उन्होंने। एक मास्क तक तो दे नहीं पाए, कुछ वो नहीं कर पाए। खैर अब मैं ज़्यादा आपका समय ख़राब नहीं करूँगा। 1 घंटा 10 मिनट हो चुके हैं और मैं चाहता था 30-40 मिनट में ख़त्म करना, लेकिन फिर भी बात बढ़ गई कि मैंने कहा नया वर्ष है, थोड़ा डिटेल में बात की जाए, बहुत से लोग होंगे, इसलिए मैंने थोड़ी डिटेल में बात की है। और अब मैं कल जब दूसरा डाटा मिलेगा तो फिर आपसे बात करूँगा, देखते हैं टेस्ट बढ़ते हैं घटते हैं। अगर टेस्ट घटे तो ज़रूर मैं बात करूँगा। क्या टेस्ट बढ़ गए तो कोई बात नहीं, हो सकता है मैं फिर 1-2 दिन का गैप दे दूँ, क्योंकि इतना समय रोज़ तो मैं नहीं दे सकता, और भी काम है। इसीलिए अब मैं चाहूँगा कि आपको सलाह देकर मैंने जो दी है, अपनी सलाह पे रहें तो